Top story tonight is not the political turmoil in Tamil Nadu or even the developments at Infosys. This is something which concerns all of us and specifically our hearts. A landmark decision which could save many lives. So if you're worried about the high cost of an angioplasty, that is the insertion of a stent in the arteries to remove a blockage, then don't be. The NPPA, which is the government agency in charge of drug pricing, has mandated that no stent can cost over 30,000 rupees. CNBC TV 18's Archana Shukla takes us through the details.
Valentine's Day is all about beating hearts, and the authority in charge of drug pricing has taken that to heart, quite literally. In a move that gives major relief to millions of heart patients across the country, the NPPA has declared that the price of bare metal stents, which are essentially wire meshes, be capped at 7,260 rupees against the current price range of 25 to 75,000 rupees. Advanced stents like drug-eluting stents have been capped at 29,600 rupees against a prevalent range of 75,000 to 1.98 lakh rupees. This same order also observes that it was found that huge unethical markups are charged at each stage in the supply chain of coronary stents, resulting in irrational, restrictive and exorbitant prices in a failed market system driven by information asymmetry between the patient and doctors, pushing patients to financial misery. End quote.
जो निर्णय आया है ये एनपीपीए का, इसके अंदर चेयरमैन साहब ने जो रेट फिक्स करवाए हैं वो बहुत ही सराहनीय हैं। हम इसका स्वागत करते हैं, लेकिन यहाँ पे एक बहुत बड़ी दुविधा ये है कि जिन कंपनियों के पास प्रॉफिट ज़्यादा है या जिनको मार्जिन की आदत पड़ गई है, वो कंपनियाँ डॉक्टर और हॉस्पिटल के साथ मिलके एक नया नेक्सस स्टार्ट करेंगे कि भी ऑपरेशन के साथ साथ वो अदर चार्जेस लगवाएंगे।
While the breaking of the nexus is being lauded, some doctors say that the blanket pricing order leaves a lot to be desired.
The government, by bringing in this capping policy, will certainly break this nexus, which is a good thing to happen. They have basketed all the drug-eluting stents, whether they be the modern ones or they be the old ones, as well as the biovascular scaffold, into one category. That, I think, is a kind of an unfair situation, because I can tell you very certainly that many products will possibly get withdrawn from the Indian market very soon.
The NPPA order is a big blow to the players in the 1,500 crore rupees Indian stent industry, which is heavily dependent on imports and has spent years opposing the application of a pricing cap that could be market disruptive.
We're deeply disappointed by this decision, and we really are concerned about the impact this will have, especially in the long run, on patient access and generally the innovation ecosystem in India. You look at some of the data that NPPA shared, the extensive markups were not at the point of the manufacturer, that there were other points along the supply chain. The singular focus on the price of just the device without looking at other elements of the healthcare delivery system is short-sighted.
Even domestic manufacturers who were pushing for a price cap to boost local manufacturing are a little taken aback.
We do want to give benefit to the consumers, and we were hoping that the prices will come down to half or one-third level. But to come down by 85%, this has moved to the other extreme. The more concern, of course, for us is not only the price part, but the way it has been implemented. The government expects that all the stocks in the market will have this lower price overnight. And how will that be achieved?
Implementation apart, some experts argue that unless the overall costs of healthcare, especially private hospitalization and doctors' charges, come down, these price cuts will not prove to be a game changer for heart patients in India. In Mumbai, Archana Shukla.
Well, joining us now to take some of those issues forward, Dr. Naresh Trehan, a famous cardiologist and chairman and managing director at Medanta. Doc, appreciate you joining us here on CNBC TV 18. As our story there was very clearly articulating, the order from the government states there has been a nexus. We've heard now of how in the supply chain the markups have happened, which the NPPA calls unethical. It also says that there have been restrictive trade practices. Is this now an indictment of the manner in which the Indian healthcare services sector has been acting?
Well, you know, the thing is that what this new policy has done is, one, it's welcome to the point that it will improve the access for people to access much needed succor, because you know, when you're getting a heart attack or when you're suffering from critical coronary artery disease, you need treatment, and stents do play an important role in the treatment. Now, if they were expensive, yes, many people would not be able to afford them. So from that point of view, this one stroke has made it possible for the access, and that's a good thing. The only thing that is being debated right now is at what price does it become like viable for companies to provide and for the hospitals to deliver it to the patient.
So at 30,000, Dr. Trehan, is it viable or not?
No, I think that it depends on what the manufacturer is going to give it to us at. The basic thing is, like some of the manufacturers saying, even the Indian ones, that it's maybe capped at too low for them to be able to deliver the product. Now, that is yet to be seen, but I welcome the fact that this has brought this putting a cap or some perspective and transparency into the system is a good thing. It was needed. It'll help many people to access healthcare, which is a great thing. But at the same time, it has left many things unaddressed. And those things are the newer stents, the more specific stents which you need for certain situations like bifurcation stents or stents which are required in situations where somebody's going to go undergo a big operation or a kidney transplant or a liver transplant in an emergency. Now, those stents are special stents which have a different price point.
Okay.
So on one thing, it has become transparent at what price these international companies were bringing in the stents. We didn't know that. So the doctors and the hospitals may be blamed saying that they were charging you, but we didn't know what the pricing was. We were just going by what was allowed by the MRP. So I think that this puts a good perspective on it. It'll find its level, and I welcome it for one that it'll bring a lot of people into be able to access healthcare, which everybody deserves.
So just from a practical perspective, Dr. Trehan, you know, for instance, if someone were to go in for a surgery tomorrow, do we now switch over to the new pricing automatically?
No, I think that, you know, that's what the devil is in the detail, that how do you implement it? One, everybody will have to implement it eventually, but the stocks that are lying in there, which were brought in at a certain price, how can you sell them or provide them at a loss? Now, how it will happen, we don't know yet.
Okay.
But it's something definitely that needs to be addressed, and I'm sure many things will come up with the government to also address. These are points that may not have been considered before.
Okay. The other clarification that I was looking for, I understand now that you will have to bill separately. So the billing of the stents has to be done separately, and the procedure cost will have to be billed separately. Is there clarity on that, or the worry is that perhaps there could be some costs that will be added on by the hospital?
We were always doing that. We were always billing it separately. Now, the main thing is that, yes, for clarity, it should be billed separately so that it becomes transparent. I think transparency is the important thing in medicine, because there are two question marks being raised against these practices. One was the pricing, and I think that the pricing was opaque from the point of view that at what price were they being imported. We didn't know. Now that the industry has developed in India, which is a good thing, that the pricing came into the open to say, yes, we can manufacture a stent in India for 10,000, 20,000 rupees. So from that point of view, it has put the right perspective. Second thing is that we must take into consideration that there are newer technologies which will definitely be more expensive, and people who need it and who can afford it should be allowed to take it. The second thing is that there are accusations that 1 in 3 stents are unnecessary. We have, for the last 2 years, been proposing, and we've been practicing it at Medanta, the heart team concept, where nobody alone decides what therapy the patient will have if there's any gray area.
Okay.
So a clinical cardiologist, an interventionist, and a surgeon will sit together and find the right recipe or customize it to the patient, so that the patient also knows that due consideration has been given what's the right thing for them.
Okay.
So in day life, you will find no abuse of any unnecessary procedures. So these are safety features which we need to bring into our practices in India as we mature in our delivery systems.
Well, I guess the order, you know, we've seen the government intervene in this fashion because some of those safety features that you just talked about haven't been taken forward by the healthcare services sector, Dr. Trehan. But we do hope that this is a step in the right direction, and the clarifications, the much needed transparency does come in. But appreciate you joining us here on CNBC TV 18. That's Dr. Naresh Trehan. But on to